where we'll be talking about effective communication skills. Our objective for this class will be to list key skills needed for effective communication, establish the most effective way of communicating by offering regular, timely, easy to understand medicines information to patients, devising key phrases or questions which can be used in a patient-centered consultation. This series is a part of learning to improve effective or to ensure patient-centered skills are developed by pharmacists. But since your course curriculum contains just this part, this portion taught by me, I will provide lessons in this area only. Essentially, to have training in effective patient-centered care, you would need to understand effective consultation skills, effective communication skills, and how to improve patients' medicine adherence, and more practical skills in putting all of these together to give your patients the most a wonderful time and have them, give you high ratings. So, haven't talked about the consultation. I haven't talked about how to put your patient in the middle of the care process. It's time to consider your interaction with the patient in more detail. So, in this section, we're going to look at the key skills you need in order to communicate effectively. The term communication has a wide range of meanings and applications. In this program, we're referring to face-to-face or sometimes digital communication with your patients, either over the phone, over the internet, or through mail. Bear in mind that other forms of communication, such as written or pictorial information, can also be useful to support discussion. Here are a few things I think you should reflect on as you think about communication skills. Think about the last time you talked to a patient. Some of you were already in the wards before the lockdown ensued, and some of you have volunteered or have served as locum illegally in pharmacies, community pharmacies. Now, think about the last time you talked to a patient. What sort of questions did you ask? Did you use lay terms, or did you fill your communication with technical jargons, or did you use a lot of abbreviations? Did you check that you had been understood by the patient? Do you know how to check for understanding in the patient? Now, this will form the crux of our discussion. And just to show you, these are some of the things I had mentioned. I accept that principles underlying patient-centered care and management include effective consultation, effective communication, and medicines adherence. Now, the underlying theories for consultation, of course, are not a part of this topic, so we will not dwell on that. It's important that as a pharmacist, you consider putting the patient at the center of all decisions about their own health. This is important because research has shown, or there's evidence to support the thought that patient-centered care is the most responsive model of effective patient care, meaning that it engages the patient more, it allows the patient to be more involved in their own care, and patients who are at the center of their own therapy often report higher qualities of health or higher qualities of life than those who are in a paternalistic or other form of relationship with a healthcare provider. Also, um, even though it may appear complex, it is the most effective. It appears complex because it's probably the most studied pattern of uh, communication with our patient center. It's the most studied principle of care for patients, but it is not the most difficult. The most difficult probably is a paternalistic, in which a lot of times you ignore cues from the patient and kick ahead without considerations for whether they understand, whether they are performing the care you expect them to or not. It's also important to mention here that when you communicate effectively with patients, there is a higher satisfaction level. There's less distress among patients, less anxiety, less depression reported among older patients, and there's higher acceptance among younger patients. Also, higher rates of medicine adherence because you achieve shared understanding, and there's better outcomes because patients' behavior align more with the discussed or the plan for adherence than with other methods of care. Now, what are the principles of patient-centered care and management? Just so we understand the basis for or the reasons why we're proposing effective communication with our patients, I think it's important to look at the pyramid um, proposed by Pickers, called the Pickers 8 Principles of Patient-Centered Care. First on the list is respect for the patient's preference. It's part of the ethical bent of being a pharmacist, that respect for the autonomy of persons, that respecting people's desire to choose one decision over the other. It's important. So you need to respect your patient's preference. For example, you may be providing care for a patient and have one or two alternatives and be, interested that the patient should choose the best alternative according to you. They may decide to choose the alternative that best fits their own lifestyle, but is not the best in terms of clinical outcomes. In that situation, you must still respect the patient's preference and work with them, support them, even though they did not choose the best position that you felt was responsible. Coordination and integration of care means that you cannot be the only person in charge of this patient. You need to reach to other care providers, ensure that they are in the loop with all of the care points that you're initiating with the patient, and that you also do not disrupt the clinical plan of the patient. It also demands that you provide information and education in a way that is relatable and contextual to the patient's lifestyle, preferences, beliefs, culture, and norms. So, for example, you need to respect that this patient lives like as a social animal within their communities, and it's important that you respect, or when you're providing information and education and providing interventions, you think of all of these while providing it. Think of the patient's physical comfort. Some patients actually rate their own physical comfort better than the clinical outcomes. So it's important that you keep that in view when you're proposing treatment for your patient. Emotional support is also important. Emotional support does not push you towards sympathy, but demands that you're empathic, that you push empathy, you put yourself in the patient's shoes when counseling or consulting with the patient. You involve family and friends. Patients whose treatments involve their family and friends are more likely to to go through their treatments and adhere for longer. So in the short term, they adhere, And in the long term, they persist in the use of their medicines or other lifestyle changes when they involve family and friends. But of course, you need to also respect the choice of the patient. If they do not want to involve family and friends, it's up to them, not up to you. In terms of continuity and transition, there's a continuum of care from emergency to ward to the community, and then where needed to specialist care. So as a pharmacist, it's important to, as the patient is, if you're in the hospital, as a patient is being discharged, to give them a list of their medicines that have been discontinued or have been used within your facility to go on to the next facility, which of course is a community pharmacy. And then, of course, the community pharmacist also documents the patient's care so that when they're transiting to for example, terminal care homes, terminal care facilities, or elderly care homes, the patient is also transitioned from the community pharmacist to the pharmacy hosted within the care homes or within the terminal homes. Okay, access to care. It's actually the pillar that upholds all of these. Access to care talks about ensuring, beyond your own pharmacist training, ensuring that there's provision of, for example, there's access to capital to pay for their medicines, there's reduced cost of care to the patient, there's also consideration for lower hindrances in accessing care providers. For example, during the lockdown due to COVID, it calls for innovations around, telepharmacy, telehealth considerations where patients can access their care provider and, of course, get their medicines, no matter how far they are from the hospital. So these are the principles of patient-centered care and management. You will notice that they draw on both our professional training and our emotional intelligence. So it's important that we keep that in mind. Effective communication. Um, these are the 5 principles that have been outlined by Suzanne Kotz, and they are effective communication principles for effectively counseling the patient. Number 1, effective communication ensures interaction rather than direct transmission. This is important because the sender and receiver of the message are independent, so there needs to be some interaction or feedback about the impact of the message. Just listening or just giving advice is not enough. Number 2 talks about reducing unnecessary uncertainty for the patient. If common ground and mutual understanding have first been established, then any uncertainty can be openly discussed. If areas of uncertainty are not discussed, are not resolved, then blocks to effective communication, such as lack of concentration or anxiety, can come up during care. Number 3, if you look at that, it requires planning and thinking in terms of outcomes. It is important to have planned and thought about the aims of the consultation beforehand. If not, you will, get into a point where there are starts and stops. You will start using a tool, you will change your mind again, and it will become very confusing for the patient. The direction will not be clear to the patient, and they may end up being confused. Demonstrates dynamism. It's important to be flexible. Yes, we said plan, while thinking in terms of outcomes. Now, when you start your consultation process, it's important, or your communication process, it's important to be flexible, engaged, and responsive. Engaged. You see, when you're speaking with your patients, do not be caught, in other things, pinging on your phone, texting on your phone, chatting with your colleagues or other things. It's a disrespect to the patient, and it passes you off as unserious and unprofessional. So be flexible, be engaged, and be responsive in any given situation. and to recognize that what may be appropriate for one situation may be inappropriate in another. Remember, we talked about being culturally sensitive. So be culturally sensitive when working with your patient. Follow a helical model. Okay? Communication gradually evolves through interaction in a spiral way, each person influencing and building on what was said by the other person. Okay? This also fittingly produces repetition and summary. So don't be afraid to repeat what your patient is saying. That helps them, that shows them that you're listening. And also, don't be afraid to ask them to summarize back to you or provide a summary of your discussion, because that proves to them that there is shared understanding happening. From these principles, we can begin to understand why it is that in any situation, not just in healthcare, when someone communicates effectively in this way, we feel that we have really understood, the person. Now, communication skills. To communicate effectively with patients, you need to develop the skills of questioning, assessment, informal sharing, and assessing the reaction of the person, and discussion. These have been listed on the screen. In fact, many of these elements also are important in consultation, right? So it's important to maximize your opportunities while the patient is in front of you. Before you can offer any advice, treatment, or information, you need to identify the patient's needs. The most effective and direct way to do this is to ask questions. Okay? If you can recognize the quality, the purpose, and the types of questions and develop the ability to use them appropriately, then you are well on your way to communicating effectively in a consultation setting. There is, however, a need for balance, because if all the questions are asked by the healthcare professional and none by the patient, this may suggest that the healthcare professional is relying too heavily on questioning. In fact, it will become an interrogation. Okay, so you need to be very careful about that. Now, there is a consultation framework that we're also going to use in discussing this, but this might come up later. Okay, so let me just quickly run through. Number one, what you want to do when the patient is in front of you is to discover why the patient is here with you. And number two, to consider other problems. So you need to think about how you frame your questions to identify the patient's concerns, problems, and concerns. Frame your questions appropriately. Framing your questions appropriately will help you find out the patient's impression of their problems, will also help you find out the physical, social, and emotional impact of these problems on the patient and their family. With effective probing and questioning, you may find that the real reason for the patient's attendance may be quite different to their initial reason that was discussed with you. Number three, choose an appropriate action, right? Whatever action you have decided on, at this stage, it is important to involve the patient in the decision-making process. To do this effectively, you need to share relevant information at a level appropriate for that patient, checking that the patient understands. Patient organizations report that too few patients receive information about their medicines that they can understand and use. This shows a failure on the part of healthcare providers to educate them contextually. Research also shows that some patient groups have poor health literacy skills. This aptly describes what our Nigerian patients are experiencing. Health literacy is so poor in Nigeria that sometimes a few reports have shown that up to 90% in a care facility do not understand clearly the health information being provided by their doctor or their pharmacist. Health literacy is defined by the WHO as the cognitive and social skills that determine the motivation and ability of individuals to gain access to, understand, and use information in ways that promote and maintain good health. It is important to be aware of this problem. Some ideas to help address this issue include: don't make assumptions about which population groups have poor health literacy. Offer all your patients alternatives to written information. Older patients are more likely to have poor health literacy. So when dealing with older patients, ensure that you remain empathic and open to other forms of communication with them. Review information leaflets with your patient and ensure that they can also read this simple leaflet in their own spare time. Think critically about basic instructions on medicines labels and consider how to explain them to patients. For example, oftentimes we label medicines with strokes, and at the end, patients misinterpret these or due to poor eyesight may look at these labels and overdose or underdose. For example, a patient read off a nicotine patch, read that, an opioid patch, read that the patch should be applied to the top of the arm once every 3 days. Should be applied to the top of the arm and removed every 3 days. So the patient interpreted it as putting the patch, after 1 day, remove it, and wait until 2 more days before reapplying a fresh patch. Instead of putting one patch to stay on the skin for 3 days so that the skin would have absorbed enough of the opioid to get a steady state concentration within the blood. This led to failure of therapy and the need to transition this patient to stronger therapy with more side effects. Asking the right question can also elicit how much involvement the patient wants in making decisions about their health. This provides an opportunity for joint decision making and is an important factor in ensuring high medicines adherence. Number 4, achieve shared understanding. After taking the history, you need to summarize and reflect back to the patient what they've just told you as you understand it. For example, hi sir, let me just put this all together. What you've said so far is that you've been having to get up in the night to take your indigestion mixture. You've been avoiding eating fish, you've been avoiding eating fried foods, and you still feel a lot of discomfort right in the middle of your body. Is that correct? Now, this is you reflecting back to the patient. You are looking for agreement with this so that you can confirm that you understand the patient's concerns from their point of view, not from yours. If the patient doesn't agree with your summary, then you may need to try another approach. It is always a good idea to ask the patient if there's anything they want to ask you, anytime, both during, but especially at the end of a consultation period. This can help you to impart further information if there's something they haven't understood, and the patient can reveal something that has been troubling them that has not yet been raised either with you or so far with their medical doctor. Number 5, involve the patient in management. You need to involve the patient and discuss treatment options in a way that the patient understands so that they appreciate the implications and are able to make what is termed an informed decision as a result of your education. Once you have provided relevant information in a clear and accessible way, you then need to be able to assess the patient's reaction to the information you have given and determine any concerns they may have. Number 6, while you are being thorough, remember to use time and resources appropriately. One patient should not, spend all of the time in the day with you. You will end up being an ineffective and a useless pharmacist. So spend your time appropriately, maximize opportunities. It's important to take the opportunity to effect appropriate changes in the patient's lifestyle and get commitment from the patient to follow agreed decisions. Usually, I mention that when I'm taking these classes, I always mention that if it is a new patient, then it would be reasonable to spend 15 to 30 minutes with that patient. That's if they're picking, if this is their first time, they just got the diagnosis, it is usually appropriate to take 15 to 30 minutes with them. If the patient is refilling their medicines, they're already conversant with all the drugs on their prescription, then 5 to 7 or 8 minutes is enough with each patient for you to communicate all of this with them. If, however, the patient has one new medicine, at least one new medicine on their list, then you must be willing to spend between 10 and 15 minutes with them, because that new medicine can throw up an interaction that will mess up all of the gains that you've had since treatment started. So ensure that you do not gloss over important details. Number 7, establish or maintain a relationship. Be supportive of your patients. Use empathy to show that you have some sense of how the patient is feeling. Okay? Use educated guesses too. Okay, so show patients that you have some intuition, or you're reading them, or you're reading the room, as is usually said. Okay, so tell them, for example, you can say, you say you are coping well, but I get the impression you are struggling with this treatment. Is there any reason why? Even if the guess is incorrect, it shows the patient that you are trying to further your understanding of their problem, and it buys loyalty. Remember that you need to be careful. If you said to a carer of a terminal cancer patient that you know how they feel, unless you actually do, you can easily cause them to be more upset. So don't tell people that you know how they feel. In fact, as a rule of empathy, do not tell people you know how they feel. Rather, tell them that you share empathy with them. Okay? Do not tell them that you know how they feel. That's just dumb. In summary, the points you need to bear in mind: try and let patients tell you their story freely. When you use questions, try and keep them as open as possible so it doesn't feel like an interrogation. Use all of your senses to listen. Communication are of two types: verbal and non-verbal. Verbal is the words that they speak. Non-verbal includes their tonality, their body movement, their facial expressions, the way they sit, the tonality of their voice. Are they speaking hurriedly? Are they shuffling their feet? All of those are part of non-verbal. And non-verbal makes up close to 90% of communication types. So if you ignore non-verbal communication, you ignore it at your own peril, and you will not effectively communicate with the patient. Check that what you think is wrong is what your patient thinks is wrong. You must come to alignment with the patient. Keep an open mind and always ask yourself if you are making assumptions. Be prepared to consider or reconsider the causes of symptoms that you or a colleague has decided upon. Help the patient to be involved in the decision-making process by providing them with all the relevant information in a clear and accessible way. Here's a question that you can reflect on. Look at the 5 principles that we've talked about earlier on. Okay, look at these 5 principles in the table. Okay, now, and the skills and competencies that I've talked about. Identify areas where you need to improve upon and then begin to work on them. Okay, some of the the tasks that you'll be given also, pushes you in the direction uh, to work on this yourself. Okay. Uh, Quickly, before I go on to the next, I want to emphasize again. We've talked about these skills, these communication skills, and different communication types, verbal and non-verbal. I've described verbal and non-verbal. Questioning includes open-ended questions and close-ended questions. Open-ended questions are questions that require the patient to describe something to you. Can you describe how the pain feels? That's an open-ended question. Do you still feel your pain? That's a closed-ended question because it can end in a yes or no. Okay? So use them interchangeably, and of course, ensure that during your questioning, you do not use a lot of closed-ended questions. It makes the patient, feel like they are being interrogated. And don't use too many open-ended questions. The patient will relax and give you irrelevant information that will make your consultation more complex. Okay? Assessment skills include physical assessment skills, and of course, physical assessment skills have also been handled by one of the doctors who took you in your previous text, in your previous lectures, preparing you for PCL 505. Also, importantly, physical assessment skills are required when you need to also look at reasons that have been put forward by your what's it called, by your colleagues, to be sure that their diagnosis is appropriate for what to be sure that their diagnosis or their working diagnosis is appropriate. Information sharing and assessing reactions, of course, has to be at a level relevant to the patient, and it has to involve the patient. We've discussed this earlier. Of course, discuss treatment options, to summarize and reflect back, ask if the patient has any other questions. This is just to summarize all that I have discussed using the Pendleton's consultation model. Those were the 7 steps I discussed earlier. Okay, haven't talked about that. Let's quickly look at how to take a patient medical history. However much we computerize records, there can be no better way of gathering information than talking to the patient, and usually this face-to-face. But with telehealth and telepharmacy, you're gathering medical history, of course, over the telephone or through Skype or Skype calls or any other method. So taking a patient medical history is a structured approach to finding out about health problems in a way that enables you, the pharmacist, to obtain all relevant information and arrive at a conclusion. It is one of the main functions of the consultation, and it's a useful therapeutic tool for both the patient and you, the pharmacist. If we also bear in mind the 5 principles of effective communication that we had looked at initially, right? We can start to measure how good our communication skills are when taking a patient history. Patients often say that they have to repeat the same thing over and over to lots of people. This is true. However, taking a medical history from a patient is still considered to be the best way to obtain relevant information and make an accurate working diagnosis. The accuracy of the diagnosis varies between studies and depends on the problem, but usually you will be able to at least document 70% of relevant medical history. Where specialists are needed, especially where medicines, maybe medicine interactions, or or medication related issues are suspected, a pharmacist is the professional of choice to carry out medical history. Now, taking a medical history is not just for diagnosis, it is part of the sharing process. It gives the patient the opportunity to have a good moan, to complain well and, offload everything that is on their chest, right? Talk about their situation and can uncover problems that the patient has not acknowledged to themselves. For example, depression. Many patients will hide depression, but if you allow them to speak, you will be able to find out if they are depressed or not. Now, this process of taking medical history helps develop the patient professional relationship and promotes empathy and understanding, right? A lot of you will end up finding out that there's a class of patients called difficult patients or persistent patients, right? Sometimes they're called heart sink patients, right? They visit regularly and are difficult to help. They are also difficult to communicate with. So you need to develop your history taking skills to ensure you make the best use of available consultation time. The information the patient gives you during the discussion will be their real or perceived symptoms of illness. If you are planning to make a physical examination, you might then need to identify clinical signs that you watch out for. Matching clinical signs to reported symptoms enables you to make a working diagnosis. For example, if a patient presents with an itchy scalp and on examination, clinical signs of nits or lice on the scalp are found, then a diagnosis of head lice can be made. There is little point taking a medical history unless you are able to act on it. It is helpful to consider if you are likely to be able to address the main complaint. If not, then ensure that the discussion is brief and that you refer this patient to someone who can take action. For example, if there is a surgical need, there's no need dilly-dallying. Just refer the patient immediately. It's less stress on the patient, less stressful for the patient, and of course, they'll consider you as a professional help. Okay. However, if it appears that you can supply or prescribe a product, then you should aim to walk through each of the areas outlined under patient medical history. First and foremost, you need to identify the patient correctly so that when you document facts, you are not documenting onto another person's record, but onto the appropriate patient's records. Remember, names can be easily confused. Passport photographs may not be appropriately matched. So please check again. Use at least their name, their year of birth, and at least their address or phone numbers to identify and be sure that this is the right patient. Number two, then encourage the patient to describe the main problem. For example, the reason why they have come to see you. You can start with, what seems to be the problem today? What can I help you with today? These are ways of getting the patient to talk about this point. Discuss each problem completely before moving on to another. Asking questions to clarify any information about duration, severity, date, and time of onset, links to events that may have been the cause, and the nature of the problem. If they then mention multiple complaints, you may say, if I can improve one thing for you today, which would you like it to be? In this way, you'll be able to identify their most pressing complaints, solve that, and then go to solving the less serious ones. You may also need to ask about the impact of these problems on their everyday life. For example, does it have adverse effect on work? Is it affecting their hobbies? Is it affecting their daily chores or social activities? Ensure you identify the impact. Once you have identified the main problems, Repeat back what you have been told by summarizing, e.g., you know, you can ask, okay, so as I understand it, you have been having fever for the last 5 days, you've been coughing, you've been sneezing a lot, your fever doesn't break during the day, it's steady, graded all through, you know. Of course, don't use those jargon, steady, graded, don't use those, but repeating back, in simple words, what the patient has said to you ensures that, you can confirm to them that you're on the same page. Number three, patients may already be taking another treatment. So you need to find out what other treatment is ongoing or just completed. Okay? Explore what was done and whether anything they have already tried was effective or if it made any difference at all. Ask about their current health status and medical care. Has any medical help been given? For example, if they're having a cough, most likely they have used the cough syrup before they even came to you. Cough syrups are over the counter. They may have done that. They may have licked honey. They may have added garlic. Nigerians, the way we do, right? So be sure to find out what they have done. The fourth step, ask about any past illnesses, including mental health problems, hospitalization, surgery, or long-term treatment. Ensure that this is contextual and not just out of curiosity. Ask about any past illnesses, okay? That seem to relate to this current one. For example, it should be contextual and relevant to their current complaint, right? Discuss any medications they've also taken. Like I said, most patients will present having taken over the counter medicines, or when they can no longer manage themselves, they will present to you. Okay? Also find out if there have been any recent changes to their sleep, diet, if they started using tobacco or they stopped using tobacco, if they recently started exercise or stopped exercising. All these are important. Okay? Now, next step, ask about family diseases, including diabetes, hypertension, kidney disease, heart attack, stroke, asthma, allergies, cardiac rhythm problems, cancer, osteoporosis, or mental health problems. These are important when you're building your database, you know, uh, especially not just for the now, but for, future complaints, or to ensure you're not going to be given the wrong treatment that can interfere with the past, or, cause a past illness to recur again. Ask about significant childhood diseases or injuries. Find out their social history, which may include marital status, children, occupation, and living arrangements. Living arrangements is, of course, very important with communicable diseases. The next step is to find out their social history, which may include, oh, sorry, I mentioned that already. Social history, yeah. The next will be to interpret the information that you've been given. Okay? And then, of course, you need to think to yourself, what do I make of these responses? Do they make sense? Am I missing something? Or do I need more clarification from the patient? At the end of this, you will be able to get enough information to, provide a working diagnosis, or at least to help the patient. Now, there are a few common pitfalls that I find a number of us make during counseling sessions or during consultation sessions. Number one is that you ask too many questions, often irrelevant. Don't ask too many questions unless you have decided fairly early in the process that you can provide initial care, or unless you plan to undertake physical examination. Short intervention should be linked with short history taking. Don't go too far. Another thing you can, another very simple uh, schema that you can use is called 2WAM. Okay, and 2WAM basically may let me add it somewhere here. I mean, it's a very brief. So ask what is wrong at this time. Sorry, you start with who. The who. You go to the what. You go to how long it's been. You go to allergies or any other condition. Are you following? And of course, finally, any other medications, or you recommend medications at this point. Okay, so one of the fastest ways to do this, on the shop floor or in your hospital practice is to use the 2WAM. That's the 2WHAM. The first W is who, helps you identify the patient, right? Um, Here's my pen, thank you. Okay, oh wow. The first is to help you identify the patient correctly. Who? You want to know the age, you want to know the sex, you want to know if the person is female, are they pregnant? You also want to know, especially if they're asking for information, you want to know their skill, their health literacy skill. Okay. Now the what? What is wrong? What is wrong? Okay. Uh, that helps you describe the main problem. Also helps you identify uh, past or current illnesses. What is wrong? How long has it been? So this still helps you within this context. How long has the disease been for? Allergies or any other condition. Excuse me. Allergies or any other condition helps you identify family history, uh, and also helps you identify some sort of social history at this point. And then the M, which is the medication, looks at medication history, medicines they've taken before, and of course, also looks at where you are interpreting the information to begin giving solutions. Okay. Now, importantly, avoid using a tone of voice that sends the wrong message. What is your problem today, Mr. Davis? What is your problem? That's not the tone you should use, right? You should ask in a way that's empathic and that encourages your patient to talk. Ensure you show respect for any cultural, religious, or ethnic differences. Be very, very careful. Cultural sensitivity is important. Be careful about your choice of words and never make assumptions about people. Now, this approach that I have outlined, there are two approaches. Number one, I've outlined one, which is more detailed, and then I've also outlined the 2WAM process, which is more summary, but also helps you um, take medical history in a useful form. It's important to develop a method suitable for your practice and that you're comfortable with. You can adopt any of these two. 2WAM is very simple to use and it's intuitive, for pharmacists. You may want to consider different approaches for different situations. For example, short interventions, medication review, full medical consultation, all of them. Of course, you use different different styles for different occasions. Okay. I also want to ask that you act as a patient advocate. Okay. Uh, some patients will have difficulty expressing their concern. You need to use tact and diplomacy. Okay. Um, in some cases, the patient may simply not want you to know. Okay, and you must respect their wish. If they don't want you to know a certain information about them, you must let it go as long as it's not, even if it's something that you need to make a treatment discussion, a treatment decision, then you should be able to refer them to somebody who they are more comfortable with and they can discuss further with. Um, as the last, I think this is the last, yes, the last part of our discussion, barriers to effective communication. Let's remove this. Thank you. So, some of the barriers to effective communication, um, regardless of how good your skills, there will be times when the consultation will not go according to plan. Uh, you will need to be able to identify a reason for this, and maybe something you can tackle, but sometimes the reason will be outside your control. So most of the barriers to effective communication are due to misapplication of skills. For example, a lack of skill and understanding of the structures of discussion and conversation. It's important, and that's why we went through, all of those principles, and then of course the skills you need to develop, and then how to carry out, a professional structured consultation. Okay, very important. Sometimes it may also be due to inadequate knowledge of other communication skills, including body language. I mentioned that body language makes up almost 90 to 95% of all of the discussion. If you don't know how to read the room, you don't know how to read body language, then you'll be missing out on 95% of the communication that's going on. That's a huge loss, both to you as a professional and to your patient. So it's important to develop, you can take trainings along the line of improving your emotional intelligence. That would be one of the best investments you'll make into yourself as a professional. Lack of personal insight into other people's communication difficulties can also hamper your ability to communicate properly with them. Sometimes you may also undervalue the importance of communication, or you may have a negative attitude towards communication. And that's seen, sometimes when health professionals are dismissive of, patients. Sometimes the patient comes to you and they tell you that the doctor had finished writing the prescription before they even finished their complaining. Sometimes they also come to the pharmacy and you have already written on their on their medicine packs before allowing the patient to even discuss or share with you their challenges. Okay, that's a negative attitude and you need to work on that. Okay, now a lack of inclination to communicate with patients, sometimes this may be due to lack of confidence, really. Sometimes you mask it with being brutish or brisk with patients. All of these, it will not afford you the opportunity to grow. So you need to, if you're not confident or if you don't feel competent enough, go over those communication skills again. Try and take some exercises along those lines and improve yourself. Sometimes tiredness or stress from having to deal with too many patients may also be a challenge. Besides barriers, there are also other behaviors that are used. These are called blocking behaviors. You know, healthcare professionals may find it difficult to move away from medical concerns in order to deal with psychosocial issues, and find it difficult to adopt a more negotiating and partnership style. They are so used to the paternalistic, I'm the healthcare provider here, you are the patient, so you listen to what I'm saying, you do what I'm telling you to do. That's a wrong approach to your patient, and it's a blocking behavior. This is demonstrated if there's reluctance to ask about social and emotional impact or problems on the patient and family. Sometimes you don't feel like discussing with the patient because you feel like it will take you outside your areas of competence. Nobody is asking you to start a psychiatric or a specialist psychoanalyst practice. No, what they're asking you is to consider the impact of the disease in just being empathic, just understanding how it affects the patient alone, sharing that concern with them and, trying to understand it can also help you identify where they may need services that you can refer them to. Okay? These blocking behaviors increase patient's distress. They end up making the patient take up too much time, and it threatens your emotional survival as the professional. So respond to emotional cues. Don't block the discussion. Respond. Okay? When you block, it leads to poor communication. Okay? Some patients also use the blocking behavior. For example, they may believe that nothing can be done for them. Sometimes they don't want to burden you as a professional. They don't want to seem pathetic or ungrateful. They feel uncomfortable or feel it is inappropriate to mention certain things to you. These are also some blocking behaviors, okay? Now, I want you to reflect on a few questions. Think about all that you have read, all that you've read so far, all that we have discussed so far through this video, and then jot some of them down and seek to take action to improve yourself. Okay? In summary, I want to say good communication plays an important part in patient-centered healthcare. So it's important for you to gain the necessary skills to communicate well. Benefits of this can be seen not only in the patient pharmacist relationship, but also in a good working relationship with the healthcare team. With that, we'll come to the end of this session. If you have questions, you can send them to me or post them to the discussion forum. I'll be glad to provide answers. And my email address is c@unilag.edu.ng. Okay? Again, c@unilag.edu.ng. You can send your questions to me via email or put them in the discussion forum of PCL 505. I'll be glad to respond. Thank you very much, and appreciate your attention and look forward to sharing a quiz with you within the next 2 days. So please watch out for the quiz and participate. Thank you very much. Have a good evening.